Hi, I'm Dr. Mayura, and I'm going to talk about some of the main causes of fatigue. Now, we all experience tiredness at times because tiredness can be relieved by sleep and by rest, but fatigue is overwhelming tiredness which can't be relieved by sleep and rest, and it's something which is impairing your functioning. You're not able to perform at work. You're not able to go to the gym. You're not able to perform even your daily chores at home. All you feel like doing is resting. That's fatigue. And there are a lot of people who experience fatigue and they don't know why. And I want to go through some of the common conditions, medical and lifestyle, why you can be experiencing fatigue and not have a reason. You don't have a chronic medical condition. You don't have things like chronic liver disease, chronic kidney disease, chronic lung disease, heart disease, or any chronic inflammatory condition, and you're experiencing fatigue. So what could it be? Right? Let me go over some of the common reasons that you could be experiencing fatigue. So the first thing I want to speak about is lifestyle, which is sleep. If you're not getting enough sleep, which is 7 to 8 hours recommended for adults, 7 to 8 hours of uninterrupted sleep, then then that might be causing your fatigue. Now, we all need sleep because it helps us store memories, it helps us, perform, biological functions, it helps regulate and restore our energy levels. So when we're not getting this 7 to 8 hours of restorative sleep, then we are at a risk of being fatigued. And sleep also has to be at the correct time. So you have to be sleeping in the night and be awake in the day. This is circadian rhythm, because some biological processes happen in the day and some happen in the darkness in the night. So it's researchers say that 2 to 5% of all shift workers, people who work, who are awake at night and who are asleep in the morning, they undergo sleep problems. So this is very important. So sleep hygiene is extremely important. So have a technology free room. Do not take your cell phone into the room. Do not watch TV before you go to bed. Drink something calming like chamomile tea. Have a warm water shower. Leave all your problems at the bedroom door before you come in and you're ready to sleep. Have a mattress, a comfortable mattress, and keep the room extremely dark. You don't want to leave the lights on and sleep. So all of these help with sleep. So that is one of the causes of fatigue. Now, make sure your sleep is good. Otherwise, please talk to your physician or your sleep doctor to find out more. Now, in the same topic of sleep, there's something called sleep apnea, which is a medical condition. And sleep apnea is nothing but when you in your sleep, when you have periods of apnea, when you have periods of no breathing, but you don't know it. So you are having episodes of no breathing and no oxygen entering your brain. So this usually happens with people who are obese or people who are alcoholics or smokers, and you tend to know this when you ask them about snoring, and usually these people snore, or people who have sleep apnea. And you can test this by doing a polysomnography, which is a sleep study. So your doctor will do a sleep study and he'll be able to diagnose this for you. And if you do have this, you'll of course have to lose weight and stop all the habits like smoking and alcohol. And there is a device which is called a CPAP, which gives you continuous pressure, which keeps the airways patent and open. So you're not going to go into episodes of breathlessness during the night, because sleep apnea can lead to other conditions like hypertension and exacerbate those conditions. So you want to solve this. So this is another. So these people with sleep apnea always complain of excessive sleepiness in the day and a lot of fatigue. So that's another, a thing on the same aspect of sleep. Now, diet. Diet is very important. So you need to know that you're getting if you're not getting enough food and fuel, you will feel tired. So if you have an eating disorder, or if you're restricting your calories too much, then you'll feel very fatigued. So you have to have about 1,200 calories per day for your normal functioning. Now, if you are eating too much but you're not eating the right foods, then that is also a cause for fatigue, because if you're eating processed food, you're eating a lot of refined carbohydrates, you're eating a lot of sugars, you're not getting the required nutrients and minerals you need for your body to function correctly. That's another reason for fatigue. So you have to make sure that you're eating the right foods. So a lot of people say, yeah, but I eat a lot of food, I should feel very energetic. But that's not how it works, because you need to eat the right foods. So fill your diet with a lot of fiber-rich foods, a lot of vegetables, a lot of iron-rich foods, a lot of foods which are rich in vitamin B12 and folate. So and a lot of protein. Now, refined carbohydrates, you are under the pretense that you get energy, so you get a short burst of energy because of a spike. When you eat sugars and carbohydrates, a spike in your glucose, your insulin is released from the pancreas, and then the glucose shifts into the cells, and then quickly there's a drop in your glucose levels. So this continuous up and down spike in your sugar is not good for you. And you also, it's a vicious cycle, because when you think you're feeling, when your sugars go down, then you again want to pick up a carbohydrate and eat it, and again your sugars spike. So it is a vicious cycle. So eat whole foods, eat brown rice, eat protein, eat fiber-rich foods, rather than refined foods. Now, another category of foods which are not good for you and cause fatigue are paradoxically, are energy drinks and caffeine. So these are all stimulants, and they will increase your BP, they'll increase your heart rate, they'll increase, they make you jittery, they'll make you anxious when you have too much of them. But also they will make you crash all the more once the effects wear off. So be very careful about caffeine, and caffeine also alters sleep, causes insomnia, and energy drinks, because they have a lot of sugar and caffeine in them. Now, so diet is very important, because you want a diet rich in iron, vitamin B12 and folate, and you want to also, with sunlight, you want vitamin D. So you want all of your vitamin and minerals to be in check. If you don't have this, you can possibly get anemia, which can be vitamin B12 and folate and deficiency anemia. So there you have to supplement yourself with vitamin B12 and folate rich foods, and also probably take a supplement with that. Now, you should talk to your dietitian and your doctor and ask them what are the foods required for this. Now, you can also have iron deficiency. And iron deficiency anemia is one of the most common types of anemia. And anemia is nothing but a lack of red blood cells. So you have a lack of oxygen going to parts of your body. So you'll feel weak and fatigued. So now if you have a poor diet in iron, you will have symptoms of fatigue. And what are iron-rich foods? Spinach, broccoli, drumsticks, red meats, liver, and nuts and beans, etc. So these are all iron-rich foods. Again, please talk to your dietitian or your doctor to find out more about what. And also, if you have an iron deficiency anemia, you should supplement yourself with iron and vitamin C as well to help absorption of iron. So an anemia can be due to various things. So you can have a lot of blood loss through heavy menstrual bleeding, postmenopausal bleeding, uterine fibroids or uterine polyps, pregnancy, GI bleeding, ulcers, taking medications like aspirin, which can cause GI bleed. So there are a lot of causes of anemia. You can also have aplastic anemia, where your own body is not producing your red blood cells, or leukemia, which is a blood cancer. So there are a lot of causes for anemia, and the most common is iron deficiency anemia. And a lot of people have that through a poor diet. So that's about diet. And now, another cause of fatigue is depression and anxiety and other mental health conditions. Depression can cause fatigue when you don't understand why you're fatigued, but you are, because you're mentally exhausted. And depression, of course, you need to speak to your psychiatrist or your general physician to help you diagnose this depression. It can come in, you can have sleep disturbance, you can have feelings of guilt, you can have feelings of worthlessness, feelings of suicidal ideations, you can have had an attempt of suicide, you can have panic attacks. All of these come under depression and anxiety and other mental health conditions. So please be aware of this. This does not have to have any, you can have overwhelming fatigue actually with depression and anxiety and other mental health conditions. Also, on the same line of depression, when you are taking some medications like antidepressants, you can also have fatigue with those as well. That is a side effect of some antidepressants. Now, you can also have, speaking about depression, that links right to the next thing, which is called fibromyalgia. So a lot of women actually around the age of 45-50 have fibromyalgia, which is a condition where they have a lot of musculoskeletal and soft tissue pain and they have disturbances in sleep, and this can be triggered by stress or infections. And so this is another cause where they have these symptoms over 6 months, and they have trigger points where when you press certain points, it's very painful for these individuals. So this is another cause of overwhelming fatigue. And for fibromyalgia, the treatment is basically acupuncture, massages, physical therapy, behavioral therapy, probably cognitive behavioral therapy, talking to somebody, and exercise, of course, because exercise, paradoxically, you think you're too tired to exercise, but exercise actually increases energy levels, no matter what condition you have. Even if you have chronic fatigue syndrome where there's no reason behind fatigue, exercise actually helps create elevate your energy levels or increase your energy levels. Now, you can also have other medical conditions, like you can have food allergies. Now, we all think of food allergies like we think that it's rashes and hives and maybe digestive issues and runny noses, but food allergies can also present as fatigue. So go to your allergist or your doctor and ask him to do a test to check for these, or he'll probably do an elimination diet to see how your energy levels, if they increase or not. Celiac disease. So people have all kind. You have allergy to gluten, to soy, to corn, to beans, to nuts. So they all can cause, and even lactose, for example, can cause fatigue. So that's another cause. Now, speaking about food, water. When you have a lack of water, when you're dehydrated, that can cause fatigue. Even mild dehydration can cause fatigue. And the signs of dehydration are dizziness, fatigue, headaches, and basically loss of skin turgor, and your urine will be extremely dark. So make sure that you drink about 8 glasses of water, 8 ounces per day, and that also varies depending on your gender, depending on your physical activity, and things like that. So it's very important to have a nutritious diet. Also keep yourself very well hydrated. Now, some medical conditions like thyroid, hypothyroid can cause fatigue. Thyroid symptoms are you can feel you're eating normally, but you're gaining weight, and you don't know why. Also, you're feeling cold intolerance, you're feeling you have dry hair, you have dry nails, you have a hoarse voice, you have constipation, you have muscle pain, and you have depression, and all of these symptoms together can cause overwhelming fatigue. So check your make sure your doctor checks your thyroid levels, and he'll do a thyroid function test to check that for you. A UTI can also present as fatigue if you have burning maturation, or if you have, when you do a urine test and you have white blood cells in your urine, sometimes this can also cause fatigue. Another cause. Now, speaking of lifestyle, let's talk about stress. So stress is there's something called adrenal fatigue, which is not exactly a medical diagnosed term, but people are still researching into it, where you, when you are stressed, your body releases cortisol, the stress hormone, and adrenaline as a fight or flight mechanism. But if you're constantly stressed, your body is constantly releasing this, and it fatigues itself. So you have adrenal fatigue, and all these levels drop. So in this condition, you can have things like reduced BP, fatigue, headaches, craving of salt, and things like this. So you can also check your levels of cortisol and talk about adrenal fatigue with your doctor. So now I just want to make sure that everyone knows that fatigue is a symptom that comes with almost all medical conditions, and you can feel this. But these are the common reasons someone who's otherwise healthy can be undergoing chronic fatigue and not know why. So I hope this helps, and please talk to your doctor if you are feeling fatigued, or if you have, if you are suspecting that you have any of these conditions, and to get checked. Thank you so much.